is Beatrice Akullu. I'm in charge of Loro Health Center 3, a health facility found in Loro Town Council, Noyam District. Today we are overwhelmed to receive a number of people turning up for a medical camp organized by one of our MP aspirants, Acilo, who planned this camp in line with the district officials. The medical camp started by mobilization, district entry, and then down to the grassroots, where we received communication from the district that we are one of the facilities chosen to host a medical camp, which is organized by Jen. So today morning we received over 400 clients who turned up in need of the services which are organized. The aim of the camp is to bring medical services nearer to the community of Oyam. And the camp is to provide other services that are not being provided by this health facility, most especially the specialist services. These include the eye services that our people don't have access to, the dental services, and maybe physicians for cases that we cannot handle at Loro Health Center 3. Other services which were offered today included general OPD, antenatal care services, under which we had abdominal ultrasound scan, and then we also undertook cancer screening, immunization of children. Then the eye clinic was also operating. Dental services were just given treatment, among the few services that we had to offer today. Among the 400 people who turned up, at least successfully, we managed to attend to 310 cases. That is a registry at the entry point. However, the segregated data for each department we are not able to compile now, as the services are still ongoing up to this time. And to talk about the referrals, we are going to make a summary at the end of the day. Then we are able to break down which cases were referred where and for which purpose. Okay, first and foremost, I'm deeply humbled and touched by the trust that the people of Loro always accord the medical camps that are organized. This is not the first of its kind. We've always had medical camps organized by the district. We've also had medical camps organized by different implementing partners, and surely the turn-up is always big to this number. However, this one in particular, there are so many exciting things that our community had to receive. First in point, when they come to receive services, at least we encourage them to carry their medical books which they buy on their own. But today, to their excitement, you're getting out with a book and all the prescribed medications, you're able to receive all of them. That is the difference that I have with this medical camp, and it has to some extent reduced on the number of medical supplies that we spend, because they had to carry them along. True. The ones of today were enough, the ones that they brought, yes. Okay, day one, just like any other person, it's not easy to begin any activity on day one. It's a little bit disorganized, trying to assemble and then make the flow perfect. Wasn't really that easy. It made all the service provision and delivery start a little late, a point in